My name's Quinn. I'm a retired obstetrician and gynecologist. Today we're going to talk about the etiology of adult hypertension. Appreciate it's a little unusual for obstetricians and gynecologists to be discussing such subjects, but it looks as though the pathophysiology is very similar to both fetal and pregnancy hypertension, and that places it very firmly in our orbit as well. Now, this work was done in two tertiary centers in China. The first one is in Wenzhou, which is in Zhejiang province, and the second one is in Shanghai Jiaotong Dashi, Shanghai Jiaotong University. And it was done in this hospital, which is the Peace Hospital, under the leadership of Professor Huang Hefeng, FRCOG. It's the main ward block here for 16,000 deliveries. The labour ward is on about level 4. This is the outpatient department, and this is the service unit with pathology on the top floor here, radiology lower down, and different subspecialties accommodated in the lower floors. The whole of it sits on one of the entrances to the underground station, the Shujiahui underground station, which makes it very convenient for many women to attend. Now, the key to this talk is this paper from 1937, which is entitled Arteriolar Sclerosis in Hypertensive and Non-Hypertensive Individuals by Moritz and Mary Oldt at Case Western Reserve University in Cleveland, Ohio. And what they did was they looked at 100 hypertensive postmortem subjects and 100 normotensive postmortem subjects, and they looked at the visceral arterioles of all the primary abdominal organs, so kidney, spleen, adrenals, and pancreas were the ones that were largely included in this study. And what they found was that these arterioles were narrowed, and they were narrowed uniformly across the board in all of these 4 organs. And they looked at 8,000 tissue blocks, 8,000 separate specimens to derive a measurement of what an abnormal arteriole was, because it's difficult to define what's normal and abnormal, what size of arteriole we should be looking at, and that sort of thing. But what they came across was a universal definition, which said that if the vessel to lumen diameter was less than 1.4, the chances are that the arteriole was normal and uninjured, whereas if the ratio was above 1.4, then there was a significant risk this was an injured or narrowed arteriole. So we've had a look, and this is what we find. This is in the same organs, in kidney, spleen, pancreas, and adrenal, and we looked at 22 post-mortem hypertensive specimens, and we found the same arteriolar sclerosis in the kidney, spleen, pancreas, and adrenals. This is using a standard hematoxylin and niacin stain. In this column, we're looking for injured vasomotor nerves, and you can see here, this is using anti-S100 as the staining antibody, and you can see these little brown flecks all the way around the outside of the renal arteries here, renal arterioles, in fact. What you don't see is any nerves on the endovascular side of the vessel. So I'm not sure how endovascular ablation does its work and has its effect in reducing blood pressure, but the injuries to the vasomotor nerve seem to be on the periphery of the arteriole. We look in spleen, you can see again all this layer of injured abnormal vasomotor nerves which have sprouted after an injury to the vasomotor nerve. With same in the pancreas here. This is a cutting artifact of the nerve bundle. We don't think the rest of it is, and pathologists have been a little hesitant to discuss the loss of nerves in a nerve bundle, peripheral nerve bundle, because of the potential for cutting artifacts. We think this is a cutting artifact for sure, but this is not. We think this is part of the pathophysiological process. And here again in adrenal, you've got injured perivascular nerves around the thickened arteriole. And in this circumstance, you've got hyperplasia of the adrenal cortex in adrenal cortical hyperplasia associated with injured arteriolar nerves, and we're not sure that that's been recorded in the literature either. In this row at the top, I've included uterus because this is a pregnant uterus with a halo of hyalinized nerve, hyalinized empty cells around a thickened arteriole. Here in this column, you can see this dense layer of injured vasomotor nerves. And in this column, you can see that the injured arteriole, narrowed arteriole, has a positively stained for P2X3, this brown stain, for this stretch receptor, which we think is important in the initiation of preeclampsia and pregnancy hypertension. Notice it is negative in kidney, spleen, pancreas, and adrenal. So it opens up the opportunity for using an anti-P2X3 agent in this sort of setting. And I think there may be many opportunities for anti-P2X3 agents if one becomes available. We think the mechanism looks something like this. Here's a normal arteriole and its vasomotor nerve, again in longitudinal section. We think that exposing these vessels to lifestyle choices, adverse lifestyle choices, raises the blood pressure, the intravascular pressure here, and eventually injures the vasomotor nerve by a simple mechanical injury, which releases a lot of cytokines, IL-1, IL-2, IL-6, and TNF in somatic nerves. The autonomic injury hasn't been studied in the same detail, to my knowledge. And these have two effects. First of all, there's regeneration of injured nerves around the periphery of the arteriole, and then there is hyperplasia of the denervated arteriolar wall, which contributes to the arteriolar stenosis. So two effects for the single injury, and we think that's very important in terms of the genesis of both fetal, pregnancy, and adult hypertension. So to summarize, we think that adult hypertension is associated with the thickening of the denervated arteriolar walls, and that there is that arteriolar stenosis is associated with injured vasomotor nerves. We think that the injured vasomotor nerves result from adverse lifestyle choices in contemporary living, and that the optimal treatment may involve interruption of the the processes of arteriolar stenosis, which we've yet to fully understand. So, in summary, we think the arteriolar stenosis is associated with injuries to vasomotor nerves. The key injuries are from our 21st century lifestyles. It's the same processes in both fetal and pregnancy hypertension. And there may be some opportunities not only to block the renin-angiotensin system, but also to interfere with the progress of the neurovascular injury, which becomes so extensive throughout your viscera in this process. So something a little novel, something a little new, something to reflect upon. And thank you for listening. We look forward to seeing you again next time.